Imagine decades of movement behind you. Long walks through parks, errands, daily strolls that once felt effortless. Yet now, after 75, those same walks can feel incomplete. Not because walking has lost value, but because the body, in its natural evolution, demands more than distance and repetition. Joints require support, muscles need reinforcement, and balance must be retrained. As an orthopedic surgeon, I see the subtle ways that walking alone can leave gaps in strength, coordination, and independence. Gaps that, if unaddressed, quietly increase the risk of falls, fatigue, and functional decline. Walking activates the legs in a linear pattern, but it rarely challenges the full range of movement the body needs in daily life. Standing from a chair, shifting weight, or rising from the floor engages muscles in 3 dimensions, recruits the core, and stimulates stabilizing systems that walking alone cannot reach. When these movements are performed deliberately and consistently, they send signals to the nervous system, reminding the brain that the body is still capable of controlled power, balance, and coordination. Muscles respond, joints strengthen, and circulation improves, creating a rhythm of resilience that walking simply cannot replicate at this stage of life. There is a quiet science to this approach. Engaging the body in functional patterns that mirror daily activities strengthens not only muscle fibers, but also the connective tissue, ligaments, and tendons that protect the joints. It enhances proprioception, the body's innate sense of position and space, which deteriorates with age, yet is crucial for safe, confident movement. Circulation improves as the large muscles contract and release, supporting oxygen and nutrient delivery throughout the body. The nervous system integrates these signals, reinforcing balance, stability, and spatial awareness. Equally important is the psychological effect. Mastering a controlled, purposeful movement fosters confidence, reduces fear of falling, and encourages more natural activity throughout the day. The body remembers capability through repetition, and the mind grows comfortable with independence. In essence, functional, controlled movements become a bridge between physiological necessity and lived experience, allowing mobility, resilience, and confidence to flourish even when walking is no longer sufficient. After 75, the body changes in ways that are subtle but significant, and walking alone often cannot address these shifts adequately. While walking has long been considered a cornerstone of healthy aging, it primarily engages the legs in a linear, repetitive pattern, leaving critical systems understimulated. Muscle strength, particularly in the thighs, hips, and core, begins to decline gradually, and joint stability becomes more fragile. These changes may not cause immediate pain or limitation, but they reduce the body's ability to respond to sudden challenges, such as stepping over an obstacle or regaining balance after a misstep. Walking maintains endurance, but does not sufficiently strengthen the muscles that protect the joints or train the nervous system to coordinate complex movements, which are essential for maintaining independence and preventing injury. The risk of functional decline after 75 is compounded by the natural slowing of reflexes and the subtle loss of proprioception, the body's innate ability to sense its position in space. When walking is the only form of exercise, these systems are rarely challenged in a controlled, meaningful way. The result is often a quiet erosion of confidence and mobility, which can lead to reduced activity, further muscle loss, and increased likelihood of falls. Recognizing that walking alone is insufficient allows us to shift focus toward movements that directly address the body's needs at this age. Exercises that involve weight shifting, rising from a seated position, or controlled multidirectional motion engage multiple systems simultaneously. They strengthen the muscles that stabilize joints, train the nervous system to maintain balance, and improve circulation. In this way, older adults can maintain functionality, reduce risk of injury, and preserve independence. Walking remains valuable for endurance and mental well-being, but to truly support a resilient, capable body after 75, it must be complemented by exercises that target strength, stability, and coordination in a more comprehensive and intentional manner. Functional movements like standing, shifting weight, and controlled rises are far more than simple exercises. They're essential patterns that engage the body in ways walking alone cannot. After 75, muscles lose mass and strength gradually, joints become less stable, and the body's ability to respond to unpredictable movement diminishes. Walking primarily involves forward motion and repetitive leg activity, which maintains endurance but does not challenge the muscles, joints, and nervous system in the multidimensional ways necessary to preserve true functional independence. In contrast, functional movements mimic everyday activities, recruiting multiple muscle groups simultaneously while encouraging coordination, balance, and controlled force production. For example, rising from a chair engages the quadriceps, glutes, and core while training the body to generate power safely. Shifting weight from one leg to another improves balance and challenges stabilizing muscles that walking rarely activates. Even small variations, such as gently twisting or reaching during these movements, recruit additional muscles in the torso and hips, creating a network of strength that supports joint integrity and mobility. These movements are inherently multidimensional, combining vertical, lateral, and rotational components that reflect real-life activities rather than the limited forward motion of walking. Physiologically, functional exercises enhance circulation, stimulating blood flow to the muscles and joints, which supports nutrient delivery and cellular repair. They also activate the nervous system in ways that walking alone does not, improving proprioception and coordination, which are critical for safe movement in older adults. By practicing these movements consistently, the body adapts to maintain stability, reduce fall risk, and reinforce confidence in its own capabilities. Ultimately, functional movements are not just exercises, they are training for independence. They prepare the body for daily life by strengthening muscles, supporting joints, and enhancing balance in practical ways. When integrated into a regular routine, these movements create resilience, allowing older adults to move with confidence, efficiency, and safety, far beyond what walking alone can provide. Functional exercises after 75 provide more than muscular benefits. They also actively engage the nervous system, enhancing coordination, proprioception, and spatial awareness in ways walking alone cannot. As the body ages, the nervous system experiences subtle declines in reaction time, sensory processing, and the ability to integrate signals from muscles and joints. Walking, while useful for endurance and cardiovascular health, rarely challenges these systems beyond a predictable, linear pattern. In contrast, movements such as controlled rises, weight shifts, and multidirectional steps require the brain to continuously process information about body position, balance, and force production. Each repetition sends feedback to the nervous system, reinforcing neural pathways that maintain control and stability. Proprioception, the body's ability to sense its position in space, diminishes naturally with age. When older adults practice functional exercises, they stimulate sensory receptors in muscles, tendons, and joints, improving the brain's understanding of limb placement and movement potential. This heightened awareness directly reduces the risk of falls, as the body can more accurately predict and adjust to shifts in balance. Controlled movements also train reflexive responses, allowing the body to recover quickly from unexpected perturbations, whether stepping off a curb or reaching for an object. The nervous system's engagement goes hand in hand with muscular activation. As muscles contract and relax during functional exercises, they generate signals that the brain interprets to fine-tune coordination and timing. This feedback loop strengthens both neurological and muscular systems simultaneously, creating a foundation for fluid, confident movement. Over time, older adults notice improved gait, better postural stability, and increased confidence in daily tasks. In essence, stimulating the nervous system through functional movements equips the body to respond effectively to real-world challenges. Walking alone cannot provide this level of neural training because it lacks complexity and multidirectional demands. Functional exercises ensure that the mind and body work together, enhancing safety, coordination, and overall independence, while reinforcing the body's ability to move gracefully and securely throughout the day. Repeated functional movements after 75 do more than strengthen muscles. They support the body's connective tissue, protect joints, and